Yeah, so I don't have anything rehearsed or anything. I just wanted to get you on camera. I want to.
Sure.
I'm going to film some vlogs of my experience, and
Oh,
this is a great one. And just bring into attention cavitation root canal issue.
Mm-hmm.
So basically, yeah, that's good. A little closer.
Here. Let me move to you.
Yeah.
How's that?
Alrighty. Yeah, great.
Are you in?
Yep. Hey, what's up, guys? This is one interview here where I'm going to be doing multi-part series on root canals and cavitations and the importance of it. And I flew out to Austin, Texas to see Dr. Nunnally. He was in the documentary Root Cause, and I saw you on a few different other podcasts. Mm-hmm. And it was an amazing experience, and I just want to talk to him and ask him a few questions. So can you explain, why root canals are toxic and why, when wisdom teeth are pulled incorrectly, why they create issues as well?
Sure.
Yeah.
So the issue with the root canals is that no matter how skilled you are at cleaning out a root canal, you can never remove all of the debris and the bacteria from a root canal. And typically inside a single rooted tooth there's one canal most often, and dentists have become very skillful at cleaning out that one canal. Mm-hmm. But the problem is there are 2 to 3 miles of other canals, accessory canals, that you can't get to. They're microscopic. So those have no problem whatsoever housing bacteria. The tubules are very small, but bacteria can line up in there 10 abreast. And so once you have done a root canal, you've severed the blood supply to the tooth, so you can't deliver your own immune defenses to it. So the tooth serves as this wonderful little incubator for the bacteria. And bacteria are an issue in many diseases, but they're not always the primary culprit. Sometimes it's the toxins that they produce that are a bigger problem. And as it turns out, at root canals is the bacteria that are in them become anaerobic, and anaerobic bacteria have a reputation for being bad in terms of the toxicities that they produce. So here you have a tooth that's now no longer has a blood supply to it. So that's why oftentimes root canal treated teeth are very difficult to treat with antibiotics, because you're not going to deliver the antibiotics to the tooth. And the tooth now has no way to cleanse itself because the blood supply and the lymph drainage has been removed in the process of doing a root canal. So people don't want to acknowledge that because we've been doing root canals for over 100 years, and many times they're regarded as successful. The problem is we in this country and in others have determined that the success of a treatment is the absence of pain or the absence of pathology on an x-ray. Well, that's a very poor way to determine success, actually, because the absence of pain certainly doesn't mean it's been successful. And even the absence of pathology, I even published a paper on this 5 years ago.
So continue, yeah.
So so where these root canals become controversial is this: many people tolerate root canals well, or at least we think they do. They don't have overt signs and symptoms of disease, but a lot of people don't tolerate it well, and they may have any kind of chronic or degenerative illness and never associate their root canal treated tooth with that illness. Well, there are physicians all around the country who do associate root canal treated teeth with various autoimmune diseases and cardiovascular diseases, even stroke. It's very well documented in the literature now. And so those are the patients I see. They send them to me. And our office here, and so oftentimes we remove their root canal treated teeth, and those patients have the most remarkable recoveries. I have videos of so many of these patients who have had these unbelievable recoveries. So I've become over the years a big believer in this, and I know that we're all wired differently, and everyone's immune system is different, and we can't say root canals are a bad thing for everyone, because some people are just virtually bulletproof and they can handle just about anything that's thrown at them. But there are a lot of people, because of the environment that we live in, who've become sensitized to so many of these toxins, and they're fragile. And sometimes a root canal is just part of that, or sometimes it's the tipping point. Pushes someone over, and getting the root canal removed alone sometimes can be a very significant step in their healing journey. So I think we have to evaluate it on a patient-by-patient basis, and it's such a controversial issue. I mean, of all the things that we do in this office in terms of trying to help a patient get healthy, the things that raise the eyebrows of other dentists the most is root canal treatment, and whether we should remove a tooth or whether we should preserve it with a root canal. If we have a patient who comes here and they want to save their tooth and they want a root canal, we'll find them the best endodontist we know to do it. And I have a meeting in a month with a fabulous endodontist. Her name, by the way, is Val Cantor. She lives in California. She's doing all sorts of innovative things now in terms of root canals. Ozone, using all sorts of techniques to try to get in and clean these microscopic tubules out. So I'm not going to say that root canal treatment needs to be abandoned altogether. I personally wouldn't have a root canal.
What would you do?
I'd have the tooth removed in a heartbeat. I have a tooth that I damaged right here in a car wreck. Sometimes it gives me little indications that it may be going south. And if it does, that tooth will come out quickly. And we'll just do a bridge there, or maybe a zirconia implant, but I'm not having a root canal. You line 100 dentists up here in this room, probably 95 would say that's what they would opt for. So,
did you know that Root Cause got taken off of Netflix?
I understand that.
Yeah, it's pretty crazy. Yeah. So, okay, so I had all 4 cavitations. Let me zoom out here for a second as I speak. I had all 4 cavitations infected, and most people have never heard of a cavitation. They hear that word and they think cavity. But it's degeneration of the actual bone, right?
True.
And so can you explain, I guess, my case and why it's a typical case, and what you did?
Yes.
Yeah, anything you want to share about
Sure.
my situation and cavitations in general?
Yeah, a cavitation is a diseased area. A cavitation can occur in virtually any bone. It usually happens as a result of trauma. The jaw bones are the most most common areas where cavitations are found, but athletes get them when they take a blow to the hip, or sometimes the patella, the kneecap, can become cavitated, or the ends of other bones. Any bone that has a diminished blood supply can become diseased, and the scientific name in the literature for a cavitation is jawbone osteonecrosis. Well, osteo is bone and necrosis is dead, and that's what we see most times in a cavitation. There are very few living cells. The bone has become necrotic. The body doesn't like anything that's necrotic in the body. It usually tries to slough it or push it out like it would a splinter. But we have these awesome bodies, and we're designed to help wall these off. And so typically the bone around a cavitated area will be very dense. And there's a scientific term for it called condensing osteitis. When we clean out a cavitation, or what I did for you yesterday is I made a little incision over the site where you had your wisdom teeth removed. Because that's the most common area for a cavitation in the jaw bones. It's an area where we have poor blood supply anyway. And then oftentimes we as dentists, when we're removing teeth, use an anesthetic that has epinephrine in it. Epinephrine shrinks blood vessels so that we don't have as much bleeding to contend with when we do the surgery. And but it's a recipe for a cavitation. If you shrink the blood vessels down, you don't get a robust blood flow into the extraction site, and then the area doesn't completely heal. Or maybe when the wisdom tooth is removed, or any other tooth, maybe we as dentists don't clean that area out sufficiently. And so you just don't get a good bony healed area, and they become necrotic. So we make a small incision over it, push the gum tissue back, and we have a whole series of instruments, very small instruments, so we can go in and clean these areas out. And then we like to use your own platelets. So we drew some extra tubes of blood yesterday. We spun your platelets out of there, also quite a few stem cells. And then we manage those platelets in such a way that we can take them and put them back into the site. And we found that that gives us about close to 100% healing success. If your listeners go online and they look at the number of times cavitations fail when they're surgically treated, they may find that there are 12 studies. There have been 12 studies done to determine how often they failed. And those studies, 40% of them failed. But in those studies, they didn't use platelets, they didn't use vitamin C, they didn't do any of the protocol that we do now, and we think we're close to 0% failure. So this is year 16 for us to do the surgery, and we've just seen a steady improvement in terms of the healing success. One thing that helps us determine whether a patient has cavitation is a real good panoramic x-ray. A cone beam x-ray also is very helpful. The way to determine it with certainty is to make a little incision right where the tooth was removed and just go in there and find out.
With a camera?
You can go in there. Really, dentists who do this and do a lot of it, you can tell by feel. Mm-hmm. You just enter, if you fall right into a dead space, and we curette that out, clean it out, irrigate it, use ozone, vitamin C, all those things, and then platelets seem to be the real kicker. Mm-hmm.
I have more questions for you, but I just want to make sure, if it's hurting a little bit, that's okay?
A little is fine.
Got it.
Yeah,
okay.
And we could you can actually put your hand over it.
Okay.
That can help it.
I'm okay with the pain, I just want to make sure nothing is...
But we can also slow it a bit more.
So, do you remove the periodontal ligament when you do your surgeries?
We do.
Now, is that part of the reason why when wisdom teeth are extracted, the immune system can't reach the tooth because that ligament is intact, kind of blocking the way?
Well, the ligament does serve as it serves as this. It serves as a blood supply to the tooth. There's lots of vessels in there. And it also serves as a shock absorber for the tooth. The tooth is attached to the ligament. The ligament's attached to the bone. And so it's why in any healthy tooth, you can actually move your tooth a little bit. If you put your fingers on it, you'll feel a little tiny bit of movement. It's because a tooth is not attached directly to the bone. The ligament attaches it. And most people would say you get a much better healing response of the bone if when the tooth is removed, you clean the ligament out as well. I think that's true.
Mm-hmm.
I don't think it's as critical as it used to be because the platelets, I'm telling you, platelets are a miracle.
Wow.
They're an absolute miracle.
Wow.
And if I had to abandon every adjunctive thing that we do to help people get well, but could only keep one, it would be platelets.
Wow.
And that's a strong statement because I love ozone. Ozone is a huge help to us in dentistry. Vitamin C, I can hardly get along without it either. But platelets are something I would hate to abandon.
Wow.
Mm-hmm.
So what comes out of these sites?
Yeah, when we clean them out, it varies, but most often when we clean them out, it looks like an oil slick because when an area in a bone becomes anaerobic, you develop degenerative fatty cysts. And these medullary bone or marrow, the marrow bone is fatty anyway, but it gets this. You develop all these degenerative fatty cysts when the marrow in the bone becomes anaerobic. So as soon as, and by the way, they're under 2 to 4 times the pressure of the normal marrow. So as soon as you open up, they just fall. They just gush out. It's because they're under pressure. It's another reason why osteonecrotic areas are very difficult to treat with antibiotics because there's a pressure in there that precludes your own blood supply from bringing antibiotics to the area. And it has a very poor blood supply anyway. Sometimes these are almost dry holes. If they're dry holes, we do all kinds of things to recreate a blood supply into that. And platelets help us a bunch as well.
You know, I felt pressure on all 4 of my wisdom teeth before I had this. I mean, I still feel it now because I'm sore, but for years I've felt pressure on all of my wisdom tooth sites, particularly this one, which was the worst of the 4.
Yes.
So that's interesting that you say that.
Well, you have a very keen perception of things going on in your body because you've been an athlete. You know, you're tuned in. Most people don't perceive that pressure. It is actually one way to determine whether you have a cavitation or not.
That pressure?
It is. Or you can take a finger and push it over the wisdom tooth site. And some people will say, oh, when I do that, I feel a little difference. That's actually a way, that palpating one is actually a way to kind of get a feel for whether you might have one or not.
Wow.
Mm-hmm.
You know, for years, without even knowing about cavitations, I would take like either a very small toothbrush or a water pick or like that metal dental tool, and I would try and clean that area because it was painful for so many years. And I had so much other shit going on that I never actually thought about that.
Sure.
Or thought it was anything serious. But I literally I had trying to clean, it was useless, right? There's nothing you can do if you don't open up the site. Am I right?
That's, well, I'll back up because there are some dentists who like to treat these with ozone. You can inject ozone into the site. And I'd say if you're not going to have it surgically treated, that's a good idea.
Okay.
Or there are some people also who treat these with lasers, cold lasers. I see a lot of those folks who have been treated with alternative methods. I think the best way is to curette out the diseased area and then let it fill back in, especially after we put platelets in. So, but I don't want to discourage people if they want to use ozone or try that.
But it was almost a joke that I was brushing my wisdom teeth sites.
Yeah.
That's a joke, yeah?
But you know, here's the interesting thing is that most of these sites are not painful. There is a percentage of them that are incredibly painful. There is a condition known as trigeminal neuralgia and most trigeminal neuralgias are a result of an extraction site gone bad. I think 90% of trigeminal neuralgia is described in the literature as the most painful of all human afflictions. It's an excruciating pain. It's a pain that people commit suicide over. It's a terribly debilitating pain. And oftentimes when I see a lot of these patients, oftentimes it's a result of a wisdom tooth site. And we can put a little anesthetic over this. Typically the pain in trigeminal neuralgia is up in this part of the face, sometimes the forehead. And these patients walk in, they don't want any wind to touch their face. They can't put makeup on, they can't comb their hair. And as soon as we put a little anesthetic over the site where we think the problem is, within a minute they go, oh my gosh, I can't believe it. It's that dramatic of a response. And when that happens, we know we have the site located that's producing the trigeminal neuralgia. It's a cavitation. We make a little incision, clean it out, and 75% of the time the pain's gone. 20% of the time it's better, and 5% it's worse.
Wow.
Yeah.
It's interesting, you mentioned that you insert local anesthetic in an area when someone is having trigeminal neuralgia.
Yeah.
So I watched a couple of different YouTube videos. There's a guy in California who does ozone therapy, but what he's finding is the same thing that you explained with the neuralgia, is that you insert an anesthetic in an infected site and different parts of the body will stop having pain, back pain, etc.
Sure.
Wow, that's miraculous.
That's Procaine. In those cases we use Procaine. Procaine is a fabulous anesthetic developed by the Germans years ago. And what happens, Josh, and you know this, is we don't think about this much in Western medicine. We don't think about there being blocks and these amazing energetic channels that we have that run through us. But in Eastern medicine, it's a well-known fact that we have meridians, we have these junctions or highways where electrical impulses go, and they'll travel from, every tooth is associated with a different organ. Every tooth is associated typically with even a different area on the skin, like a dermatome. Teeth are associated with the various joints and muscles and various areas on the spine. And so it's not uncommon to have someone in here who has acute gallbladder pain only to find out that the problem is an infected cuspid tooth. Okay, so we have to look carefully, and a holistic dentist will be aware of that and will be thinking, oh my, is this a tooth or is this another system that's causing the tooth to hurt, or vice versa? So these wisdom teeth sites, like you had cleaned out, are on, most importantly to me, they're on the heart meridian. And so we clean these out, and I feel great about getting them cleaned out, because we know that the toxicities associated with these can have a true impact on our cardiovascular system.
Wow.
Yeah.
Wow.
Yeah.
And you mentioned to me before my surgery that it's almost like gangrene.
Well,
the same type of bacteria.
It is. It's very similar in that they become anaerobic. Okay. So bacteria are smart. They're incredibly smart. So you can have a bacteria in your mouth that's aerobic, and you push it into an area where there's no oxygen, and they're able to morph. They pleomorph into a bacteria that's anaerobic. It'd be like you and me walking along the riverbank down here in Marble Falls and decided, you know what, I think I'm just going to jump in the river and I'm going to breathe underwater for a while.
Wow.
I'm going to breathe anaerobically.
Wow.
That's the cleverness of bacteria. And then they learn how to feed off of one another. They can become anaerobic for a while, and that environment changes. They can go back to being aerobic. It's it's an unbelievable thing the way they can pleomorph. So we've got some challenges, in medicine and dentistry when we're dealing with smart bugs. Well, that's what I hear you. 40, 50 years ago, there was hardly a bug that would be resistant to penicillin. Now there are not that many that are susceptible to penicillin. Okay, they learn how to adapt. We learn how to adapt. We adapt pretty darn well, but these little bacteria that we're dealing with in medicine and dentistry are particularly clever.
They biohack us.
They biohack. Yeah, they do.
Yeah.
Yeah, sure.
Oh, so we're going to get my results sent out, right?
Yes.
Yes. So you take some material or some blood or infected bone tissue from the area, and we send it out. And in the next video, I'll have results about what type of bacteria were on there, right?
Let's do it.
And do you find that pretty much they're all identical and they're all equally bad, or some are worse than others?
No, and oftentimes they're bacteria that are common to the oral cavity. But the problem is they got trapped inside the bone, and now they've become really a different bacteria. Just like it would be if you and I became anaerobic and could function underwater. The properties have changed. So these are not run-of-the-mill common bacteria. They're bacteria that have changed, and now they can produce toxins that challenge our immune system. Yeah. And so what we did was we took a sample of the contents of each one of these areas that we cleaned out on you, and we froze it, and it then will be sent to a DNA testing lab, and we'll find out what those bacteria were. We didn't know until we had DNA testing available to us. We had no idea the numbers of bacteria that we would find in here, because it's very difficult to culture anaerobic bacteria. If I had taken a swab of these areas yesterday that we treated on you, if they're anaerobic, by the time we get them into a dish to culture them, the oxygen has killed them. But with DNA testing, we can test the bacteria whether it's dead or alive. We're just looking for the DNA. Okay, you with me?
Yeah. And you find like spirochetes and all kinds of crap in there.
Oh yeah.
Yeah.
Oh yeah, we find. And these also, interestingly enough, these areas are known to be filled with heavy metals.
Wow.
They're like a depot for heavy metals. So if you've had mercury fillings in your mouth, the mercury, as it escapes, goes into the surrounding tissues. And if you get an area anywhere in the body that's stagnant, like a cavitation is, it's stagnant, has very sluggish blood flow, then those areas end up being a nidus or a collection point for heavy metals.
And that's kind of the base of the lymphatic system, so you just have heavy metals that are kind of seeping into the sewage system?
Sure.
Wow.
Yeah.
Wow.
Well, that's a good way to describe it.
Interesting.
Yeah. Here's what we know. The less you're exposed to other toxicities, the better off we are. Doing all those things that help us to detox are important. Clean food, clean water are critical. And I'm going to tell you one other thing for your audience, because I know you have an audience that's very much into health.
Yeah, absolutely.
One of the things that can happen is when we get sick, we can get very introspective, and it's very hard for us to see. It's hard for us even to envision that we're going to get well again. When you're in the middle of being sick, that's what happened to me. 16 years ago, I thought I had Lou Gehrig's disease. I'm going to tell you what, I didn't have ALS, but I had it in my mind that I did. And I'm actually very thankful now that I went through that experience, because I see a lot of patients who have given up hope. They don't think they're ever going to get well again. Well, I honestly never, I was a competitive triathlete. I felt like I was pretty much bulletproof in terms of my overall health. And all of a sudden, here I am, I can barely walk from here to the car.
Wow. What was it like when you were walking? Heart pain or
No,
just
no, it
joint?
was just my left side became so weak.
Wow.
This is a neuromuscular issue, definitely due to toxicity. In my case, primarily due to mercury.
From putting in mercury fillings.
Yeah, I hadn't put one in 20 years, but I had been removing them. And a dentist, some of us are much more susceptible to the impact of heavy metals. So I went from being a healthy 48-year-old male to hardly being able to walk up a flight of stairs.
Wow.
Okay? And it was about a 3.5-year recovery for me. But I know one thing, when I got it in my mind, I was going to get well. It was a game changer. Yeah, my wife and my faith, I held on to my wife and my faith. And those two things propelled me. And I'm so grateful. I'm so incredibly grateful that I went through that whole experience. So I want to encourage your listeners. You gotta, don't get to the point of hopelessness. That's a bad place to be. Yeah.
I heard that a lot of dentists have depression issues and the high suicide rate. And then I remember like reading this book a long time ago that talked about how it's because dentists hurt people, right? It's because they're hurting people all day, so they hate themselves. But would you say more so it's the mercury that they're putting in? I mean, is there a correlation?
Well, here's the interesting thing. I think there were 150 dentists young dentists in my class. And this is the nicest group of people I ever met. And of course, we were all working around mercury. And over the years, I'd have to say that an uncanny amount of depression and neurological issues happened to my classmates and to me. And we have a terrible track record. We're number one in depression, we're number one in divorce, we're number one in suicide.
Wow.
I have to think it's because of our exposure to mercury. So that's not something anybody wants to admit, but there's a lot of peer-reviewed data on dentists and their staffs, and we have a terrible neurological history.
Wow.
Yeah. Well, look at the profession that dealt with mercury the most.
The Mad Hatters?
People that felted hats with mercury.
Yeah.
And they become blooming mad people. And but very unfortunate to me that in our profession in dentistry, we have not been encouraged to take the precautions that we should take, not only for our patients, of course, primarily, but for ourselves and our staff. That's changing. That's changing. There's a protocol that's been developed by the International Academy of Oral Medicine and Toxicology, IAOMT.org, and it's called the SMART technique. SMART technique. It's an acronym for Safe Mercury Amalgam Removal Technique, SMART. So if you go to the IAOMT website, you can see who's SMART certified. Those dentists they've been trained in removing mercury amalgam in a very safe way. Yeah.
So then can I ask a question?
Sure.
So being that these cavitation sites are sort of like a cesspool to collect different types of things, when you get the cavitation surgery, are you opening that up? Does the body then have to process that out, and are there things to do to help prevent maybe just getting a little bit worse before you get better?
Great question. So are we like opening up a beehive and creating a bigger problem? I would say we try to do everything possible to prevent that from happening. One thing that we do is having vitamin C on hand. Vitamin C is a fabulous detoxifier. Not because it's a great chelator, but because of it amps up our own glutathione, and glutathione is a great detoxifier. And then also our tissues heal better. Connective tissues heal much better bone does when you have an ample supply of vitamin C. So that's why we like the tissues to have almost be saturated with vitamin C when we do the treatment. And then, of course, the other thing is when you use ozone in an area, there's hardly anything that kills bacteria and fungi and viruses. Hardly anything better than ozone. And the beautiful thing is there are no side effects. Ozone just is oxygen. Just happens to be 3 of them stuck together instead of 2. And so ozone is a fabulous gas. You don't want to inject ozone gas unless you have a medical grade ozone generator. You don't want to, this is not something you get at Walmart and draw ozone off and inject it, though. That would be dangerous. But when ozone is produced in a very clean way, it is a fabulous thing to inject or clean wounds with. Yeah.
My last question here is you had severe mercury poisoning as well, yeah?
Yes.
And it turned into what people describe as Lou Gehrig's disease.
Yes.
Okay. So that's just a manifestation, right? And I believe that all illnesses are just, you know, as you said, just a manifestation. They're a label for these set of circumstances and symptoms.
Yeah.
Were you having, for me, with my mercury poisoning, I had severe anxiety, panic, like almost torturous, not almost, definitely torturous mental loops. Did you experience that, or did you only have a physical response?
Yeah, mine was much more physical. Very interesting. And that's the thing about mercury, is that there's no barrier to mercury. So some people, it'll impact them emotionally more than another who might be impacted more from an immune response, or maybe even in terms of neuromuscularly. So there's no barrier, and it can attack any system. It loves neurological tissue. Yeah, because our neurons have a high degree of sulfur in them, and mercury goes after sulfur. Sulfur goes after mercury too. That's why glutathione has 2 little sulfur atoms in it. That's what helps grab onto mercury and take it out. Yeah.
And you spent 3.5 years detoxing it.
I did. I did.
Yeah.
I'm back.
Do you want to share any, like your top 3 favorite ways to detoxify mercury?
Number 1 favorite is sweating.
Okay.
If you can sweat, it's a beautiful, safe, and slow way to detox. People usually do better if they detox slowly instead of too fast.
Totally, yeah.
Yeah. The other thing was I was very careful not to be re-exposed. So in my profession, I'm very, very careful not to have another exposure. And then also, that also included for me eating seafood.
Do you avoid all of it now?
I've had 2 bites in 16 years.
What about wild Alaskan salmon?
I love it, and I worked in an Alaskan fishing village for 18 years. So we brought lots of salmon home. I loved it. I decided to abandon it because in my case I've never seen anybody as close to me, not even close, in terms of their mercury levels.
Wow.
So I've just decided not to.
Wow.
All fish, no matter how pristine, has some mercury in it. It's very sad.
I have 2 cans of wild Alaskan salmon in my hotel. I'm going to finish those and not have it again. I went for 3 years without having any of it, and then recently I've been having it again and almost craving it.
Yeah.
But after hearing you say that, I'll skip it for now.
You could probably tolerate it, and I probably could too. It's just not
What's
worth
the
the
point?
risk. It's not worth it.
I put microsilica on my wild Alaskan salmon,
Yeah.
BioPure microsilica, citrus pectin, and I take chlorella with it.
There you go.
So I think it's nullifying some of the toxicity.
Yeah, and then you chop cilantro up on it.
yeah. Beautiful. Okay, well, thank you so much. This was
welcome.
amazing, and more to come, guys. Anything else you want to say?
Thank you. No, we're good. You need me?